Welcome to The Explainer. Today, we're going to be medical detectives. We're going to decode a secret language from inside our own bodies, a language that speaks through heart murmurs. We'll find out what they are, how doctors find them, and what they can tell us about our most vital organ.
We all know that classic rhythm of a healthy heart, right? That steady, reassuring lub-dub, lub-dub. But what if, in between those beats, a doctor's stethoscope picks up something extra? A little whoosh, a swish, maybe a rumble. Well, that unexpected sound, that's a heart murmur. And it's the very first clue in a really fascinating medical mystery.
So what is actually making that sound? Well, that little whoosh is the sound of blood flowing in a chaotic, turbulent way instead of moving smoothly. Just picture a calm, flowing river. And then picture a set of churning rapids. That's the difference. Now, this turbulence is the clue the doctors hear. And yeah, it can point to a lot of different things. But it's super important to remember that not all of these clues point to danger.
Okay, so how does a doctor translate that simple sound into an actual diagnosis? It's not just about hearing it, it's about describing it with incredible precision. They've basically developed a whole language to analyze the clue, just like a detective would carefully document every single piece of evidence at a crime scene.
The first, and maybe the most critical piece of information, is timing. When is the murmur happening? Is it during systole? That's when the heart is contracting and pushing blood out. Or is it during diastole, when the heart is relaxing and filling back up? Just pinpointing that exact moment in the heart cycle immediately starts to narrow down the list of what could be causing it.
And believe me, the description gets way more detailed. It's almost like a wine tasting, but for sound. Is it a high-pitched sound or a low rumble? Is it harsh or maybe even musical? And how does its intensity change? Does it get louder? That's a crescendo. Or softer? A decrescendo. This turns a simple whoosh into a really rich piece of evidence. Beyond its character, the sheer volume of the murmur is another vital clue. How loud is it? Is it a faint whisper or is it a roar? To standardize this, doctors use a grading scale to rate the intensity, and that helps them figure out just how significant this murmur might be.
The scale goes from a grade I, which is so faint a doctor has to listen really carefully to even pick it up, all the way up to a grade 6. And a grade 6 is so loud you can hear it even with the stethoscope lifted slightly off the chest. Wild, right? A grade 4 or higher is even associated with something called a thrill, which is a vibration you can literally feel on the chest.
Okay, this is where it gets really clever. So doctors obviously can't just ask the heart what's wrong, but they can do the next best thing. They can interrogate it with specific actions to see how that little sound changes.
The idea here is simple, but honestly, it's genius. By having a patient do certain physical maneuvers, a doctor can temporarily change the way blood is flowing through the heart. This makes the sound of the murmur change, and that change acts like a confession, helping to reveal exactly where the murmur is coming from and what's causing it.
So for example, take the simple act of squatting. This little maneuver increases the amount of blood returning to the heart. Now for some murmurs, like aortic stenosis, this extra blood flow makes them louder. But for others, like hypertrophic cardiomyopathy, the sound actually gets softer. That's a huge clue from just a simple action.
And then, the opposite happens with something called the Valsalva maneuver, which is basically when you try to exhale forcefully, but you keep your airway closed. This decreases blood return to the heart. So now, those murmurs that got quieter before, like hypertrophic cardiomyopathy, suddenly get louder. And the ones that got louder now get softer. It's like cross-examining a witness. It gives you another critical piece of the puzzle.
So after gathering all this evidence, the timing, the quality, the loudness, and how it responds to interrogation, the detective can finally line up the potential culprits. What could actually be causing this turbulent blood flow?
Well, here are a few of the more common pathological or disease-related causes. You've got aortic stenosis, which is a stiff, narrowed valve, and that often creates that crescendo-decrescendo sound we talked about. Or mitral regurgitation, which is a leaky valve. Or even a ventricular septal defect, which is a small hole between the heart's chambers. Each one has its own unique sonic fingerprint.
But, and this is a really crucial point, hearing a murmur is not an automatic cause for alarm. This is where the story takes a super important turn. You see, just because a suspect is in the lineup doesn't mean they're guilty. In fact, a whole lot of murmurs are completely innocent.
These are often called innocent or flow murmurs, and they're caused by blood that's just moving quickly and normally through a perfectly healthy heart. They are incredibly common in children, and they can also show up during pregnancy when blood volume increases. The key takeaway here is that these murmurs have nothing to do with any underlying heart disease, and they usually just disappear on their own.
All right, the detective has collected the clues, interrogated the witnesses, and identified the suspects. Now it's time to put it all together and crack the case.
And get this, for a trained professional, the specificity of identifying murmurs just by listening, that's a technique called auscultation, can be as high as 98%. I mean, that's just a powerful testament to how much information is packed into that one simple sound, and of course, the incredible skill of the person who's listening.
You know, this quote from the source material sums it all up perfectly. It's not just the sound alone. It's the combination of the Murmurs' unique character along with the patient's whole story, their age, their symptoms, their history, that lets a doctor confidently narrow down what's going on.
Now, while listening is the key to detection and that preliminary diagnosis, the final concrete evidence often comes from imaging. An echocardiogram, which is basically an ultrasound of the heart, lets doctors see the valves and chambers directly, confirming what's causing the murmur and figuring out its impact on the heart's function.
You know, the ability to translate a simple sound into a detailed diagnosis is just a triumph of medical deduction. It really proves that sometimes the most powerful diagnostic tool is a well-trained ear. And it kind of leaves you wondering, now that we've learned to listen to the heart's language, what other secrets is the body just waiting to tell us?